Welcome, this is Anupriya, lecturer from Department of Hospital Administration, Sithalakshmi Ramasamy College, Trichy. Today we are going to see about the investigation of epidemic. The epidemiology is defined as the study of the distribution and determinant of health-related state or event in a specified population and the application of this study to control the health problems. It was defined by John M. Last. In the investigation of epidemic, the epidemiology has an important role to play. The occurrence of epidemic may be agent, host or environment. The objectives of this epidemic is to define the magnitude of the epidemic based on the time, place and person, to determine the particular conditions and factors, to identify the causes, source of infection and mode of transmission, to determine measures necessary to control the epidemic, to make recommendations to prevent recurrence. The steps involving in investigations are verification of diagnosis, confirmation of existence of an epidemic, defining the population at risk, rapid search for all cases and their characteristic, data analysis, formulation and hypothesis, testing of hypothesis, evaluations of ecological factors, further investigation of populations and risk, and the last step is writing the report. The first step we are going to see about verification of diagnosis. The diagnosis may be report which is clear and arises from misinterpretations of signs and symptoms by the lay public. It is not necessary to examine all the causes to arrive at the diagnosis. The laboratory investigation, whether applicable or not, most useful to confirming the diagnosis. The epidemiological investigation should not be delayed until the laboratory results are available. The next step is confirmation of the existing of an epidemic. An epidemic is said to exist when the number of cases is observed frequency is in excess of an expected frequency for the population based on the past experience. Done by comparing the disease frequency during the same period of a rapid search for all cases and their characteristics. The search may be first starts with medical survey to identify all cases including those who have not sought medical care and those possibly exposed to risk. The health workers may be trained to administer the epidemiological case sheets or questionnaire to collect relevant data. From the epidemiological case sheet, we collect data from the cases and from the person apparently explored but unaffected. The epidemiological case sheet, or otherwise known as case interview forms, should be carefully designed to collect relevant information. These forms including data of name, age, sex, occupation, social classes, travel, history of previous exposure, time of onset of disease, signs, symptoms and illnesses. The data, some features of data may be collected from personal contacts at homes, work, school and other places. Some social events such as parties attended, food eaten and explored to common vehicle such as water, food and milk visited out of the community, history of receiving infections of blood products attended at a large gathering, etc. The data should be relevant to the disease under this study. Next one is searching for more cases. The other infected cases are searched by the patients may be asking if he is known to the other cases in the home, family, neighborhood, schools, workplaces having on the onset within the incubation of the diseases. The case attended to the local hospital should not be able to taken into considerations. This may reveal not only additional cases but also the person-to-person spreaded. The next step is evaluation of ecological factors. The ecological factors of an investigation carried out to undertake approached measures to prevent further transmission of disease. The ecological factors should be investigated such as sanitary status of eating establishments, water and milk supply, breakdown of water supply, movement of human population, atmospheric changes as a temperature, humidity and air populations, population dynamics of insects and animal reservoirs. Some of the Some of the additional information for the investigation of population at risk are the medical examination, screening test, examination of suspected food, feces and blood sample, biochemical studies, assessment of immunity status, etc. These approaches may be retrospective or prospective. This will permit classifications of all members explored to a specific potential vehicles, whether ill or not. The next step is data analysis. The data analysis is used to classify epidemiological parameters like time, person and places. The purpose of data analysis is to identify common events or experiments and to describe the group involving in the common experiment. The data analysis are considering of three types: time, place and person. The time involves in the preparation of chronological distribution of dates of onset and constructing an epidemic curves. Look for the time clustering of cases. An epidemic curves may suggest time relation with explorer to the suspected sources, whether it is a common sources or propagated epidemic or whether it is a seasonal or cyclic pattern suggest of a particular infections. Next one is place. From place, we prepare a slot map or geographical distribution of cases and, if it possible, their relation to possible source of infection, example, water supply, air population, food we eaten, occupation, etc. The clustering of cases may indicate a common sources of infections. The last one is person. From person, we analyze the data by age-wise, sex-wise, occupation and other possible risk factors, determining the attack rate or the case fatality rate for those exposed and those not exposed and according to their host factors. Next one is formulation of hypothesis. The hypothesis is formulated on the basis of time, place and person. It includes possible sources of diseases, causative agent for the infection, possible mode of spreading of diseases, the environmental factors which are able if to occur a specific disease. The next step is testing of hypotheses. All reasonable hypotheses need to be considered and weighted by comparing the attack rate in various groups for those exposed and those not exposed to each suspected factors. This will enable the epidemiologist to ascertain which the hypothesis is consistent with all the known factors. The last step is writing the report. The report should be complete and concise. The information should be included in the final report on the epidemic. The report should be easily to understand and it not be using a technical or jargon words. The sum of the background for report writings are: first we analyze the geographical locations. The geographical locations such as climate condition. Based on the climate condition, most of the infections are occurred. Next one is demographic status, socio-economic situations, organizing of health services, surveillance and early warning systems and normal disease prevalence. The next step is historical occurrence. Historical data may be occurred by previous occurrences of epidemic of same disease locally, occurrence or similar disease in the same area or in the other areas. The next step in report writing is methodology of investigation. The methodology means the method used for investigation. In many cases, the questionnaire is a common method is used as an investigator techniques. And some of the methods are survey teams, household survey, collection of laboratory specimens, laboratory techniques, etc. Analysis of data, which includes clinical data of frequency, signs and symptoms of a particular disease, course of the disease, differential diagnosis used for a diseases, sequences or death rate. The epidemiological data includes mode of occurrence based on the time, place and the population groups. Mode of transmission can be observed by the sources by which the infections are transmitted, route of excretion of a portal of entry, the factors influencing transmission, etc. The laboratory data, which includes isolation of agents, serological confirmation, significance of result, etc. The last step is interpreting of data. It is the most important step in the data analysis. The comprehensive pictures of the outbreak, the hypothesis as to the causes, the formulation and the testing of hypothesis by statistical analysis or compared. The last step is control measures. The control measures are analyzed by strategy and methodology of implementing constraints, results, and the evaluation of a significance result for preventive measures. From this, we concluded that it may be necessary to implement temporary control measures at the commencement of an epidemic on the basis of knowledge, facts of the disease. These measures may be modified or replaced in the light of a few knowledge acquired by the epidemic investigations. Thank you.